one ovary only 12 egg it's produced. Other ovary produce 6 egg. It's as a natural cycle of like one cycle one egg the entire year. So the other particular organ is producing, then how much they injected. They want to show the success rate. They never ever bother like it is human body. Treat like some object. Okay, this many injections, you put injections on thighs, this test, that test. Because of over medication, my liver got affected. So many other health complications started. I was diagnosed with I have a cancer. Stage is 3 to 4. I think it is purely a medical ground. It's kind of over hormonal injection. It is a over hormonal medicine. Because of that reason is the origin cause of mine is it is a ovary where egg forms. We can overcome with our lifestyle and then food habits along with the proper treatment, proper medication, we can overcome. Before marriage only, like I have a PCOD and then PCOS issues, like I stayed in hostel, there is no proper food habits, like I won't eat properly, morning breakfast, all these things. I had a irregular period cycle. Once it's married, I was pregnant from first baby, it's ectopic pregnancy, it is a tubal pregnancy, it is ruptured. The medical practitioner, the doctors, they didn't diagnose for me properly. One hospital I checked, they told it's irregular periods, it's like PC, you're not pregnant. Another hospital I cross verified, they said no, you are pregnant. Then they did all basic tests also, blood test they did, they gave a folic acid tablets, all other tablets they gave, you can continue. After 3 months we will do normal scan, first scan we will do. So we also believed, even that card test also shows 2 lines, it was pregnant. Even another hospital I shown, and then I'm just showing this, no, sometimes it will show fake also, you are not pregnant. It was still confusion was going on. After 45 days it is it started kind of like a bleeding kind of thing. My mother, she was very much worried, and then and we showed to other doctor, she also said same thing, might be irregular periods only, you are not pregnant. After scanning also she told it is baby formed in tube and then it is ruptured. So they operated, it is they shown that baby, it is almost 3 months baby, it's formed in tube, its tube is small. I feel that see how the negligence of the people, we are strongly believe in doctors. They didn't 3 places I tested, 3 places they said one person told me you are pregnant, not pregnant, these all. There my treatment journey it started. They removed my fallopian tube. So you have option, the natural pregnancy, its option is less, the one more tube only it is there, my right fallopian tube is removed, left only it's all. So you start going for the treatment. So every time if you going there, the same, they will ask me to wait for the scan and then drinking water, then they will do no, it is not visible, then again we will go for the vaginal scanning, and then they will say okay, this test you have to take. And then once this treatment it started, this surround uterus, around the uterus the liquid formed, we have to do aspiration. It is they never ever bother it is human body. My treatment journey, even lot of 1 or 2 male doctors also there. The feminism that we feel shy, all that's all it's gone. Then everywhere they will treat like some object. Okay, this many injections, you put injections on thighs, this test, that test. So I was a working woman, I used to go for job with all this pain, I'll come back and going, making a schedule and then fixing appointment, going for, it is keep on, it is it's rotating. And
how long you were on, how many years you took this hormone stimulating tablets?
The one, it's almost 10 years, I'll tell. So they gave the cycle will be regular, you don't worry, there the hormone tablet started. Then later on what happened, it is it is postponed, 3 months I won't get, and 6 months my entire cycle journey is completely changed. At least previously it was a PCOD, but 45 days once I'm getting in a cycle of 45 days once, it's regularly, naturally. Once I started taking these hormone medicines of 21 days tablets, after that my entire not only that cycle, we got the mood swing, that pressure, hair fall, I put on weight. It affects the circadian rhythm of my entire life. But no one is bothered about all these things. and then they told like you only having the issue, so we will start with IVI treatment, like we will take your egg and then your husband, like they not even tested my husband's sperm count, like the quality and all. They blindly believe that like okay it will be good, and then they took a sample and they did two times IUI. That also it's not like even like I have some knowledge because since I'm working educated, I have seen my report. I don't have right tube. My like 2 ovaries, that time the cycle they are doing, my right ovary only produced an egg, 2 egg was there. So when you are doing IUI, so what they will do, they will inject through the tube and then or like they will make the sperm good quality, the sperm, and then they will inject through the injections they will inject. I'm asking this doubt to my doctor, and then when she like after that I'm asking, no, since I don't have right tube, so you might be injected to the left tube only, but my ovaries are the right ovary is only having produced the egg, 2 mature egg is there, that measurements all it is there. So how it is possible it will work it out? No, it will cross the swings, they are having like hand kind of swing, no, it will swim and then it will cross, it will capture, she told. Okay, I also believed the doctors because the science they are explaining now. So it was okay. Then again normal treatment. Then I shifted my city to the famous city. Okay, in India, it is a metropolitan city. Then there again I started with big hospitals. Started like that one doctor. She told me like, you don't worry. We are going to do laparoscopy surgery, and then we will check. Do you have insurance? They asked. I said yes, I am having insurance. So we will do a laparoscopy test to like interrogate how your uterus, ovaries, all. Laparoscopy surgery, it took 5.5 or 6 hours. After that, they come to know in between. Abruptly, they stopped. They called my husband and then they said, intention adhesion. It is maybe because of your first surgery, my ectopic first surgery. Because of that reason, like the adhesion usually post operation people will get. So what they did, this is a open surgery they have done, my first surgery, because internal bleeding was high. So they cut the tubes and removed all these things. With hurry, they just like they put all like intestine and then they stitched. So it is what like a clumsy kind of like all. So adhesion completely it's formed. That adhesion, it spreaded with many organs. Okay, even though if you come pregnant also, if you become a pregnant also, it's a normal delivery only, it's healthy for you. If it is a cesarean, then definitely the neurosurgeon, somebody people will be there, and we are trying to remove the adhesion. So it is very difficult for us because it touch with some other nerves and brain will get affected, or else like we will be bedridden. So many things they told. Because of that reason, we didn't touch the adhesion, we stopped there. This is the case situation, and then we can't able to see like what is there in your uterus. It means that it's act like a wall. That complete adhesion was there. That adhesion in that intestinal adhesion, it's act like a wall. So we are not able to see what is there inside your uterus. So we just stop. Then again, even my claim also, my insurance also not get claimed because like they they will do interrogate on all this test, and then it is a previous operation. Because of that, it is a fertility related. My insurance also not, I have spent nearly 1.5 to 2 lakhs for that. Nearly almost 6 years, no one asked any question about my husband, even family or like. So then they come to know like that, then they treated for him, they gave him medicines, and then again they said like we will do IUI, and then we will then, or else we will go for IVF. And then new hospital, then she told like we'll go for IVF because you have intestinal adhesion, and these all the reason, because my previous, each and every doctor they are taking a reason of previous things. And then I also believe it is they will give some ointment also for this all hormonal ointments we have to apply, and then they will give the injections on thighs, the hormonal injections. So she gave a overdose. So what happened? My one ovary only 12 egg it's produced. That to my right ovary. Other ovary produced 6 egg. So just imagine it's as a natural cycle of like one cycle one egg the entire year. So the other particular organ is producing, then how much they injected. So they not even bother about me and all. They want to show the success rate. She was studied in abroad. If you see her profile, it was very successful doctor. She is there in the city, and then her profile was good. London, this, that, so many people are happy. It's a twin baby, like lot of like, and then lot of success rates are there. Then because she gave lot of like high hormone injections, and then my right ovary alone it's a 12 egg. What happened? I don't have right fallopian tube. Because of that reason, is the ovaries bulged, it's not able to hold the weight of all the ovaries, all the eggs. It was suppressing my urinary tract. So what happened? It was pressing my urinary tract, so it's affecting my kidney. So I got a continuous pain. It is the pain not able to tolerate, like, so it's severe pain that for doctors it took 3 days to diagnose it. What is it? They say no, few people they will get a pain, you just admit there and we will take care of, and then they took me. The pain is intolerable, and then I'm crying like anything. 24 hours they put me in like painkiller. It's just simply he's telling that we'll keep one stent there. So we'll insert one stent between this urinary tract, and then so that if we fix stent, like then the ovaries will get the support, and then you will, the pain will reduce, and then either you keep the stent for lifelong or else it's removable also. I cried. I told them just kill me. I'm not able to tolerate all these things, like, because it is that to more than 10 days under painkiller. I know very well it will affect my kidney. First time they transferred 3 embryo, and then they gave all injections and all, it's failed. And then second time also 3 embryo like transferred, it is failed, like all the same process every time. Then later on she told me like we will do a ERA test. It is like kind of uterus one thin layer internal, the endometrial layer, they just peel off, and then they will give the test. For the test they will do whether it will accept the ovaries, a baby, it will accept to grow or not. Since you are first baby also ectopic pregnancy, so uterus. So why don't they do that early? What they are doing in small hospitals, they are hiring the people for these like injecting the embryo transfer for IVF. It is like a batch wise. Even if my cycle is normal also, they are delaying my cycle. They want all 10 people together to get the same day. The same day they want to transform the embryo. So see how, so medically they are using this, they are stopping this hormonal rhythm of cycle of regular, and so the same way already they have, it's entire thing is changed, like because of these artificial inseminations, all this everything. Then we stop. Why don't they? Because I was tired. It is almost 10 years of treatment. This journey, IVF itself, it is 2 years. IVF and before normal, like wherever. I was exhausted, and then I tired, and then I talked to my husband, and he also said he has gone, like what other, like have gone through, suffered a lot. Then he said no, we will think about the next thing. So we stopped. We didn't go back to the hospital, and they won't directly tell you this much of cost, like 5 lakhs or 10 lakhs or whatever it is. They will start with the minimum amount. What do you feel? Okay, 1 lakh, okay, 2 lakhs, okay, I will take a personal loan, I will invest 2 lakhs only, no. So you, it is kind of get into trap into that. Then you can't go back also. You can't stop like treatment appropriately, like. So what you will do? Then you will continue. Then you will borrow money, and then personally I put, even for my treatment also I put personal loan. I stopped my treatment, but I got lot of side effect issues. I put on weight, gastric, lot of stomach bloated then. So over medication, because of that, then I come to know I was diagnosed of fatty liver stage 3. Because of over medication, my liver got affected, and then that is important, right? It's for digestion. So many other health complications started. Then I took treatment, like it reduced my fatty liver, that time cholesterol, everything is high. Then again I came back to the city, and then I again pain was started, its stomach bloated. What I thought, okay, previously I had a issue, not digestion issue, gastric issues, because the same thing was, I was diagnosed with like I have a cancer. Stage is 3 to 4. Few places when I see, not only is the 4 stage, depends upon the volume they are saying. So few places 5, 6 all it is there. It was mentioned in the biopsy report. So how the volume, how like it rigorously it is there. So it is spread. It start with the origin of ovary where the egg form, and then it is spreaded my uterus, both ovaries, my large intestine, small intestine, my liver, all the organs. So how much it's spreaded, based on that only, the volume only they are deciding the stages. So I think it is purely a medical ground. It's kind of over hormonal injection. It is a over hormonal medicine. Because of that reason is the origin cause of mine is, it is a ovary where egg forms. So that is my origin. So it is spreaded slowly. So ovaries to uterus, uterus to large intestine, it is nearby, right? So it is the then intestine, and then its momentum almost 19 place. Many people had lot of side effects. Some people expired also during the treatment. So what we'll do, like that treatment, we'll hire a machine that from outside somewhere. It like at 1 hour charges 3 lakhs. That machine cost only. So the chemo medicine through machine, they will directly inject wherever it is the cells up, they cut, removed, right? It is like a wound. We have a wound because it's cutted inner organs where the cells present, that there we are just pouring acid. 3 times they did biopsy, and then they went to so many hospitals. They are like, then that doctor, he explained me, whatever treatment you have done for your baby, it's all waste. Because when intestinal adhesion is there, it is like a web. It covers the whole body organs. It spreaded all my organs. It started near to my chest and near to like the whole body. They just opened, they removed. So in that cases, how like even my uterus also, it won't function, because it is like a web. It's covered. So that even the ovulation, these ovaries also, the wings, it will go and capture, that all covered. So how it is possible? It won't, even if you do IVF also. But doctor, but no one told. See, like how much everywhere they earning money, how they play with the human life, emotions and treatments, injection, medicine, so which leads to this. One thing doctor, she told, like for this treatment, more than a patient, those who are along with her, they should be a rock. So if a strong person is next to her, definitely she can come out. And then so like strong pillar, my mom and my husband, they stood up like a rock. And then we started a treatment. And then what I did before, like my hairs started falling, and then lot. And then my husband, what he did, he went, he completely shaved his head. And then the entire journey treatment, he also don't have hair. Every 6 months once I have to take a PET scan. Even now also I'm having a fear, like, because they are not telling that like you are completely cured. They said until 5 years they can't say. After that also you can be little relaxed. Like they said, since it is an acute disease, now it transfer as a chronic disease. So whatever pain I am just going through, I have to go through all. And then but I can lead a normal life. And then they can't assure that it's completely gone, it won't come and all. So under treatment only, it is kind of under treatment only. I'm just, but I can't lead a normal life. I can't affordable. Almost we spent nearly 50 to 60 lakhs. I took a treatment in HCG.
You have spent 50 to 60 lakhs apart from that fertility treatment.
Yes. No, it's like a friend circle, family. We pledged jewels, we took loan, personal loan we took. I took 15 lakhs personal loan to give back money, or like now I'm having almost 30 lakhs. We sorted out 30 lakhs for me now. I'm having a thing. Fertility treatment alone costed it's more than 20 lakhs. Initially they told me like it is 1.52 only, like initially for like IVI, like 50k. Even I have in my inner heart like I want a baby, I like baby also, because that also it is allows me to go this much extreme like treatment, all these things. Then I realized kid only doesn't like it's not a life, it's not a whole life for us. So there is beyond that, there is a lot of lives are there. Since I gone through all these things, I never ever recommend a fertility treatment to a woman. We can overcome with our lifestyle and then food habits along with the proper treatment, proper medication, we can overcome.